Hi guys, my name is Rosemary. I'll be talking about aquatic therapy in the next couple slides. To start off, aquatic therapy basically allows individuals to experience movement that can't be performed on land or they may have difficulty performing on land. And it's a fun experience and also challenging. It's a method of treatment that is conducted in an inherently freeing environment. It not only facilitates physical benefits, but also psychological and leisure benefits as well. Aquatic therapy uses passive or active exercise and swimming as modalities of rehabilitation. It promotes psychological and physiological improvements while facilitating independence in exercise activities and or swimming. Aquatic therapy is used also to encourage participants to achieve independent leisure participation, improve their functioning, enhance their happiness, and subsequent life satisfaction and longevity. Now I'm going to talk about the history of aquatic therapy and where it kind of came from. From Asia to Greece in the 2400s, immersion of water was viewed as a religious experience and a method of healing. In the 1500s BC, water was used to reduce fevers, and by 800 BC, it was used for healing baths in England. The Greeks and the Romans believed that water had immense power and used it to treat arthritic joints and other conditions as well. By 500 AD, the use of water kind of fell into disfavor. This was around the medieval times. Physicians in the 15th century slowly increased the use of water therapy again. It wasn't until the 1700s that water as medicine came back into use with the development of hydrotherapy by a German doctor named Sigmund Hahn. Advances in aquatic therapy continued mostly in Europe, but didn't advance as much in the United States until the 19th century. And after World War I and World War II, the increased use of water for exercise and maintenance of fitness was in the United States. Aquatic therapy has several different techniques. There are 11. They include swimming, the Halwick concept, sensory integration through movement, aquatic PNF, bad ragaz, Watsu, Aichi, task type training approach, aqua stretch, unpredictable command technique, and the Burdenko technique. I'm going to go in detail a little bit more in the next couple slides, so just bear with me. The Halwick concept consists of two systems: the water-specific therapy and the 10-point program. It's usually given in a 1-to-1 ratio. The water-specific therapy uses problem-solving approach to focus on treating impairments of body function or structure. Group instructions enhance learner motivation, participation, social interaction, and opportunities for goal-directed play fun. The 10-point program of teaching focuses to help improve function and independence. Works on teaching comfort and balance rather than swimming. There are 3 phases of learning. There's mental adjustment, balance control, and movement. Mental adjustment involves recognition of buoyancy and rotational control, maintaining balance in vertical position, control and breathing, and activities that require fading out the therapist. Balance control is the use of arms and legs to restore balance in the water. And then movement is where we get the 10-point program. It focuses on mental adjustment, disengagement, transversal rotation control, sagittal rotation control, longitudinal rotation control, combined rotational control, up thrust, balance in stillness, turbulent gliding, simple progression, and basic swimming strokes. Next, we have sensory integration through movement. It is an informal but carefully planned progression of activities that result in successful movement experience to meet the client's functional goals, such as develop body awareness, spatial awareness, the pathway levels, central part movements, and locomotor movements. When using sensory integration, there are other systems that may improve, such as the vestibular system, which promotes balance, equilibrium, and posture. Proprioceptive, which is the sensation of muscles, tendons, joints, and gives information about the position of the body parts and how they are moving. Tactile, which is the sense of touch for body awareness and motor planning. Visual activities may promote eye-hand coordination, which is always beneficial. Auditory is just the ability to understand what is being said, follow basic commands. Bilateral integration is the ability to cross midline, which is basically as a child when we played patty cake, you would cross to clap the other person's hand, or what you can do is you can grab your right hand and tap your left leg and do the same with the other, and basically you are crossing midline. Aquatic PNF is proprioceptive neuromuscular facilitation. It's stimulation of neuromuscular mechanisms that help individuals with neuromuscular disorders make progress towards achieving typical movement patterns. It can be provided hands-on or hands-off. The participant is verbally, visually, and or tactilely instructed in a series of functional, spiral, and diagonal mass movement patterns while standing, sitting, kneeling, or lying in the water. These, as I said before, can be provided hands-on or hands-off, which is basically with assistance or without assistance. Bad regaz is the use of water properties to enhance movement patterns that include normal movements is usually given in a 1-to-1 ratio, which is 1 therapist, 1 patient. The participant usually lies in supine position, as you can see in the photo. He is in supine position and he has a neck flotation collar, a belt around his buttocks, and he's not wearing ankle floats, but he's wearing around his thigh. This is only given if necessary. And usually the therapist is where you see the lady right here. She is between the legs, or she will be behind the participant's head. Bad regaz works in the following patterns. There's isometric, there's isotonic, there's isokinetic, and there's passive. Isometric is designed to increase strength and stability. It occurs while the participant holds a position while being moved through the water by the therapist. Isotonic involves graded resistance controlled by the specialist. The therapist pushes or pulls the patient through the water in direction of movement while the participant holds a certain position. Isokinetic involves graded resistance as well. Participant controls resistance. The TRS stabilizes body parts while participants determine resistance by their speed of movement. And passive, participants are slowly moved through stretching muscle groups. The exercises facilitate trunk elongation, upper and lower limb stretching and relaxation, and decreasing tone. Watsu combines gentle stretching, joint movement, and deep relaxation while rocking and floating the participants in warm water. It uses rhythmical rotational movement to assist in tension reduction and relaxation. The use of free-flowing nature of Watsu is used to promote self-awareness of muscle tension and works to release tension. Works to decrease tension in the spine musculature. Watsu is designed to decrease muscle guarding and tension that occurs on land activities due to fear of falling, pain, plasticity, tone, stress, and anxiety. It improves posture, range of motion, breathing patterns, energy, and body awareness. This technique may be beneficial for patients that have chronic or acute pain, neuromuscular disorders, a head or spinal cord injury, have depression, or are victims of abuse. IEG is a relaxation progression program designed to increase relaxation, range of motion, and mobility. It combines Tai Chi concepts and Watsu techniques. It is performed standing in shoulder-deep water using a combination of deep breathing and slow, full movements of torso, lower, and upper extremities. It's also followed by incorporating upper, lower extremity movements and trunk movements. This is ideal for patients in pain in need of body awareness through space, need to improve on balance, or want to meditate. Type training approach has a set of principles that guide the therapist as they design the treatment program to reduce the participant's disability. It mostly emphasizes on functional skills performed by functional physicians. Some equipment that they may use to address functional movements would be a ball, a boat paddle, or golf club or tennis racket. They have 7 general principles to work in the shallowest of waters that the participant can tolerate. Practice functional activities resembling land function activities. Remove external stabilization as participant gain functional skills. Work in a vertical position such as sitting and standing while encouraging contractions of muscles with appropriate force in a proper sequence. Encourage quick and reciprocal movements. Encourage active problem-solving movements. And gradually increase the difficulty of the functional activity. Aqua stretch is used to reduce pain and improve movement. The process breaks down adhesions that inhibit flexibility or cause muscle tension and pain. The participants are asked to play with movement in the affected limb until they feel pain or tension, and once they feel pain or tension, they are asked to freeze exactly where they are and where they feel the pain and tension. The facilitator puts pressure where the participant feels pain or tension. While assessing pressure on the place of pain or restriction, the facilitator asks participants to move. The movement is intuitive in nature and repeated several times, with the body moving in a way that reduces pain or muscle tension. Unpredictable command technique involves random request of performance of common or uncommon movements to the participants by an aquatic therapist. The goal is successful when the participant is able to perform two or more movements at the same time. This is designed to improve awareness and control of voluntary motor movement. This would be beneficial for a variety of patients, such as those with Parkinson's disease, post-polio syndrome, fibromyalgia, anyone that may have a problem with motor planning or spine stabilization. The Burdenko method begins in the water and focuses on vertical alignment and balance. Once core movement pattern for balance and alignment is established, exercises are then incorporated that use different planes of movement. The exercise sequence includes flexibility, coordination, endurance, speed, and strength, which are the basis of the Burdenko method. It is used as a technique in rehabilitation settings for conditioning and training. Principles include it's a pain-free workout, never hit the limit, it's simple to complex, increase repetitions gradually, and it goes from deep water to shallow water to land. In the back is an image of a man that is on what looks like flotation device, but is using the Burdenko method. The purpose of the techniques is used to meet the functional goals of the participants while encouraging independence in the water environment. Theoretical foundations of aquatic therapy is following basic water properties that are to be understood because there are a number of laws of hydrodynamics and effects of immersion that are important in understanding when doing an activity in the water. There is buoyancy, which is a force opposing gravity that results in feeling weightless, and a relative density allows for floating. Hydrostatic pressure exerted by molecules upon immersing the body. There's center of buoyancy, which is mid-chest around the xiphoid process, and their center of gravity, which is at mid-sagittal plane at level of the second sacral vertebra, which is S2. When both are aligned, no rotation occurs during flotation in the water. There's also viscosity, which acts as a resistance of movement as molecules of the water tend to adhere to the body's surface. And there's refraction, which water shows resistance to the speed of light passing through and actually bend away from one's perception of ray crossing the boundary. Physical benefits of aquatic therapy are the prevention of bone loss, improve motor performance and function, an increase in strength, increase in endurance, improve in fitness, improve in pulmonary lung functioning, improve in the proprioceptive senses, and even balance. Psychological benefits is like improving body image, decreasing depression, enhancing mood, decreasing anxiety, and enhancing quality of life. We also improve leisure functioning and quality of life in general. There are 3 cases I'm going to talk about that show the benefits of aquatic therapy and how regular therapy might not have benefited and aquatic therapy did. So here we have Sasha. She's a 12-year-old girl. She has spastic right hemopharesis, which had significant reduction in strength in the right side of the body. She uses swimming as a leisure activity, so we incorporated it in her therapeutic goals. She was prescribed with 8-week swimming program, which is 2 times a week, a 45-minute session. The goals were to increase range of motion, functional use and coordination of the right upper extremities, bilateral integration, balance and equilibrium skills, and work on self-image. There was a 15-degree increase in shoulder flexion and 10-degree increase in shoulder abduction. Began to use her upper extremities also during daily living activities. At first she refused to swim with others, but her skills acquisition was increasing satisfaction and compliance of the program and goals achieved through basic swimming strokes. Another case we have is Charlie, who's a geriatric patient. He was diagnosed with amyotrophic lateral sclerosis, which is ALS, has respiratory weakness, poor lower extremity muscle strength, and fair to good upper extremity strength. He was prescribed a 10-week aquatic therapy program, which was 2 times a week, 45-minute sessions. The goals were to increase strength, increase flexibility, increase conditioning, promote recreation and socialization. He had an adapted vest and used minimal assistance during his session. This skills acquisition resulted in an increase of endurance, increased strength, improved energy levels, and happiness in daily activity. Charlie went from not being able to swim to swimming 26 length of 20-yard pool. The third case we have is Rashad, who is also a geriatrics patient. He was diagnosed with advanced Alzheimer's disease and resides in a residential facility with dementia patients for a year. He's non-ambulatory, meaning that he cannot walk. He cannot perform ADLS, which is activities of daily living, except for feeding himself. He failed the 6-week conventional therapy, and so he was initiated in the aquatic therapy using the Holloway concept for 3 months. So he had 2 times a week, 30-minute sessions. In his mini mental state exam and apraxia screen of Tulia, scores improved noticeably in the water, and his mini mental state exam improved later on land. The skills acquisition also resulted in an increase of social interaction, increase of movement, increase in complying with simple demand, and an improved quality of life. Hi guys, so I just finished the activity. You're gonna see it now coming up actually. I kind of want to talk to you a little bit of what I did, just so you have a better idea. I used two different people. I used a 4-year-old and I used a 20-year-old. The 4-year-old I used in a bathtub just for her safety and kind of weather issues outside, so we kind of adapted that. With her, I worked on balance with turbulation, so she would float and I kind of shook her a little bit. We also worked on vertical hold, which was jumping up and down while still maintaining eye contact. And I also did sitting in the water, so she stands up and squats down. Then for the second person that I used for the activities, we first started taking giant steps and mini steps. Another adaptation we kind of had to use was a kiddie pool, just because I didn't have a deep pool. So we used a kiddie pool. So you kind of see the movements of her taking mini steps, giant steps, and like lunge steps throughout the video. You see the movements, but generally that's done with water up to the waist or up to the shoulders, gives more resistance. Then we also worked on swaying like in a tree, the wind. She was kind of supposed to sway like this, like flowy, but she was so stiff that it kind of prevented her, so I did help her by adding assistance. We also worked on her control of her body while I moved her. It helped create a resistance and spatial awareness of her body. And I also did a little bit of Watsu, just so you guys can kind of see it is a little bit out of water, more out of water than it's supposed to. And finally I ended it with her sitting up and down in a little chair. You see this little chair in the back. She starts off with assistance, ends with no assistance. But those are just a couple of techniques that I use in activities, just so you guys can get an idea of what aquatic therapy is in a kiddie pool.
Hi. Hi. So, can you try and lay down for me? Looking up? There you go. Hold on, I got you. Put your legs straight. I'm gonna shake you for a little bit, okay? Hold on. Shake. Okay, now look at me. Look at me. I need you to keep your body strong. Put it strong. Hard. Okay? Keep it strong. I'm gonna wiggle you. I'm gonna wiggle you. Whoop. Keep it strong. Keep it strong. I'm gonna wiggle you. You can't hold on, silly. You gotta hold. Put your arms right here on the side. Good. And we're gonna legs straight. You're gonna float. I'm gonna hold your head. Your head's not gonna go in the water, okay? Okay? Strong. Show me strong. Okay. I'm gonna wiggle you. Wiggle you. Wiggle you. Wiggle you. Good job. All right. Can you stand up? Stand up for me. Stand up for me. Good. All right. I'm gonna hold on to you. Look at me. I need you to jump. Okay? Wait. Wait. I don't want you to fall. Look at me. Look at me. Look at me. Okay, you're gonna look at my eyes and you're gonna jump, okay? When we count 2.
Okay.
2.
3, 2, 1.
Okay, ready? 3.
2, 1.
Look at my eyes. Look at my eyes. You're gonna jump, but look at my eyes, okay? 3. Go. You! Good. High five. All right, we're gonna squat. Do you remember what? High five. All right, we're gonna squat. Do you remember what squatting is? Good job. All right, I'm gonna hold you, and you're gonna squat. Ready? Squat, squat, squat. Squat. Close your legs, though. Silly. Good. Whoa, I got you. All right, we're gonna sit down slowly in the water. Slowly. Good. Good job, Ellie. High five. Yeah.
So, kind of wanted to explain a little bit more about the activities. The equipment I only really used was the pool and the bathtub. Um, there was also a little chair at the last part um, to help for sitting down. Mm, the environment you kind of need for this is a pool, specifically with warm water. We kind of did it in chill water and it was freezing. But if it's indoors, it would also benefit a lot. Some of the benefits in these activities include increased movement, um, worked a lot on balance and stretching of the muscles. Also worked on like rotational control. The leadership style I used was the democratic, which was kind of getting input from the client or my friend here of what they wanted to do and kind of work with what they wanted at the same time while doing the activities that were needed. And I can say that the adaptations, because the water was so little, I kind of couldn't give my full support. So we adapted in the sense of like I held her a certain way that would help her float better, and she had to use her hands a little to lift up. Another adaptation I would say is the bathtub, just because for her safety we didn't want to put her in the kiddie pool, and it was a more controlled environment for her. Other than that, the activity was pretty fun to do. I kind of wish I could have done it in deeper water, but I hope this video was informative for you guys, and thank you.